Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. As we count down to the Thanksgiving holiday, many Americans are being urged to limit the number of guests at gatherings or skip having guests outside the immediate family altogether to help slow the spread of the coronavirus. My next guest specializes in infectious disease at the Medical College of Wisconsin, and Dr. Joyce Sanchez is also an assistant professor at the Medical College of Wisconsin. How are you, Dr. Sanchez?
I'm well, Andrea. Thank you for having me on your program today.
I appreciate you being here. And I just basically want to get your perspective or thoughts on people gathering for the holiday, considering we are continuing to see the numbers of new cases grow each day. So I know these Centers for Disease Control, they have several recommendations, but please give us your thoughts.
Sure. I think it's really important for people to understand as they're thinking about how they want to celebrate Thanksgiving and the holidays to follow, to truly understand some of the rationale, the reasons why we need to really consider what Thanksgiving looks like and why it really should be different than any other year that we've celebrated together. The first consideration is the rate at which we're seeing positive cases come out. So a lot of people will look at the 7-day average or the percentage of positives, but it's really that exponential growth that we've been seeing that has been unlike any other time this year, except at the beginning of the pandemic, particularly when we think about New York City. The second consideration, reason why we're really making these recommendations is because of our hospital systems and our capacities are being stretched incredibly thin right now. And not just in Milwaukee County, although in Milwaukee County, it's in a state that is of great concern, but in our state of Wisconsin and indeed across the US. And the third is that this virus is so incredibly contagious. I haven't seen anything like it in my career, and many of my colleagues would agree. And the fact that it's contagious without symptoms and people may never develop symptoms and be contagious is especially concerning too. And when we think about how contagious it is, it's those Thanksgiving types of activities indoors with minimal ventilation, eating and drinking without the masks, and having that close contact with people for prolonged periods of time. So those three things combined really set us up for a place where risk is really, really high.
Wow, it's definitely something to give thought. But the good news, I'll say the silver lining is Zoom, which we're using right now. It's lifting its 40-minute time limit for free meetings on Thanksgiving. So that's really something that people can give thought is really having dinner and celebrating with the immediate family, meaning those who are in your household, and then getting on the computer and connecting with all of your family and friends who maybe normally would have come by the house, right?
That's right. I think Zoom is a wonderful, when we talk about Thanksgiving, we think about blessings. We're in a position now that we can meaningfully connect with people, even if it's not face to face or hand to hand, but at least we can see them on a screen and cut down on some of the repercussions of that isolation. No, it's not the same. I understand that. But our technology and the accessibility to reach people is completely different than it was even 5, 10 years ago. Think about how many people have smartphones with video capability. You don't even have to have a computer or an internet connection if you have a cell phone that has FaceTime or some other platform to connect via video. There's ways to be creative in that. And I agree, the really keeping it to the core of your household, people who are with you every day, is going to be the safest way of having Thanksgiving. Now, the CDC has come out with other recommendations if you are going to have people outside of your household, with which I would strongly discourage, unless you have a very clear communication and understanding of what the activities that each person was involved with before coming together. So, for example, if you've been quarantined for the 14 days before that Thanksgiving day, and each of those bubbles, so to speak, have done that, then you're probably at very low risk of introducing things together because you've been really quarantining yourselves, and the risk of virus being transmitted in that interaction is considerably low. But I, like most people, are not able to be in a bubble self-isolated in my household for 14 days at a time. I'm a healthcare worker and people have essential jobs that they need to get to. And it's just impossible to be able to accomplish that in a way that brings down that risk. And when our house is on fire, our Milwaukee County in Wisconsin, state of Wisconsin, it's really hard to mitigate that risk unless you have specific 14 days of being isolated.
Yes, and Dr. Sanchez, it's something that's needed. Some people need a refresher and need to hear why masks really are needed and should be worn. I mean, more now than ever.
You're absolutely right, Andrea. So when we think about those activities that bring people together, if you're making that decision, you've had that conversation, you've talked about each person's health risks, you've talked about each person's level of activity in those preceding 14 days. And if you make that decision, and that's all a decision that we are free to make. And I know that there's some value in those person interactions, and maybe your family member doesn't have till Christmas to live. There are certain circumstances that I understand you can't put a value on that, at least a monetary value on it. So if you're going to do that, at least put on those layers of protection. And what does that look like? If you're able to meet outdoors on the patio, 6 feet distance apart, that is fantastic. And I know it's going to be cold. If you can bundle up and still have that meaningful interaction outside with a space heater, for example, a lamp of some kind that warms up the space, that's great. If you don't, then you could still bundle up. The second is if you are going to be going indoors, those masks, they're not 100%, but they absolutely have been shown time and time again, study after study, that they decrease the rate of transmission from person to person in that household. So wear those face coverings, at least 2 layers, well fitted, covering both the nose and the mouth. I can't tell you how many times I see well-intentioned people, they're wearing the mask, but the nose is open and it's not really functioning the way that it should. And then limiting the amount of time. So instead of a whole afternoon grazing on the turkey, try to limit it to just that mealtime, and then put that mask on and make sure that you're hand sanitizing and limiting the amount of time within that 6 feet of distance, spacing out tables, and again, limiting the amount of people, the number of people. 10 or less is great. The fewer the better, and certainly the fewer the number of people outside of your household, the better.
Yes, indeed. And a couple of things to consider is the number of COVID-19 cases in your community. And we know those numbers are high all across Wisconsin. Exposure during travel, airports, bus stations, gas stations, rest stops, all those places that travelers stop while, trying to get from A to B. They can be exposed. So it's something to definitely keep in mind. The whole goal, I think, is to make sure we're all around to enjoy next Thanksgiving. So I thank you so much for your time and the information, because I think it goes a long way. And like I said, I know many people are tired and they feel like they've heard this stuff over and over again, but we need this information more now than ever before. So I appreciate your time and thank you for all that you do as a healthcare provider or an essential worker.
Thank you, Andrea. That we're not going to be in this state forever. We just need to get through until when we can get a distributed vaccine for our entire community.
Yes, indeed. Thank you again for your time. Dr. Joyce Sanchez specializes in infectious disease and also serves as an assistant professor at the Medical College of Wisconsin. The Medical College has a COVID-19 resource center at covid19.mcw.edu. When we return to our Issues Milwaukee, we'll have some important information for individuals who may need some help paying their mortgage or rent. We'll talk to a representative from Take Root Milwaukee right after this.